Kenya has received over 1 million doses of the AstraZeneca COVID-19 vaccine, while Rwanda said it was the first in Africa to secure shots from Pfizer. As efforts to inoculate the world's poorest nations accelerate, with fewer resources and tougher logistics than other regions, African nations are racing to secure the doses needed to protect their roughly 1.3 billion people and allow the safe reopening of economies. Let's take this discussion further then. We look at the progress made in Africa and what more is needed on the continent. We're joined via Zoom by Dr. Phionah Atuhebwe. She is Regional New Vaccines Introduction Officer for the World Health Organization. A very warm welcome to you, Doctor. Thank you so very much for being with us here on SABC News.
Pleasure.
Obviously, South Africa seems to have been, the hardest hit by the coronavirus on the continent. So, it makes sense that, we should start the vaccination rollout here and be quite ahead with that. But I would argue that this is, an emergency kind of a situation everywhere. Are you satisfied with the sort of progress being made thus far on the continent, besides South Africa? It seems that some are moving faster than others, but generally, what's been your reaction to all of it?
Well, I'm happy to say that Africa has really moved now from planning to delivery of the COVAX vaccine starting last week, which is a big milestone that we're looking forward to because most African countries were looking up to COVAX for these vaccines. The first COVAX deliveries started arriving in Africa just last week, with 11 million doses expected to be delivered by the end of this week. As of today, 3rd March, we've delivered up to 8.7 million doses to at least 8 African countries, and these include Angola, we have Cote d'Ivoire, we have Kenya, as you mentioned, we have Ghana, the Democratic Republic of Congo, Nigeria too, one of the most populous country we have, has received about 4 million doses. Rwanda did receive the AstraZeneca vaccine this morning. And we're happy to note that, yes, indeed, they did secure the Pfizer vaccine through the COVAX facility. It's one of our 4 countries that are receiving the Pfizer vaccine, and they will receive those doses just tonight. But in total already, we have, in addition to South Africa, another 11 countries that have started vaccination on the continent from vaccines that are either from bilateral agreements with manufacturers or from donations. And these include that we have Seychelles, Mauritius, we have Morocco and Egypt have started vaccinating, Equatorial Guinea, Algeria, Zimbabwe, Rwanda too has already started vaccinating with the Moderna vaccine, Senegal too, and finally Cote d'Ivoire and Ghana that started just yesterday.
Yeah, I was listening to our health minister, and I wonder if you heard the clip we played just now here on the show. Dr. Zweli Mkhize saying that we are ahead. South Africa is ahead in terms of information, and I wonder if that may be an added issue that's really sort of affecting this fight against the virus on the continent in general. I mean, if for instance, as the health minister was pointing out, that some countries on the continent aren't even picking up on different variants or new variants as quickly as South Africa is. I mean, that could be really quite problematic in the fight against COVID-19, isn't it?
That is very true. That is very true. And but we've put in place the World Health Organization, the Africa CDC, and partners have put in place. We have these mobile laboratories that are supporting. We do collect samples and take them to other countries that do have laboratories. For example, South Africa is supporting a number of countries that are in your neighborhood to do this genome sequencing, and this is happening also in other countries. But also we've developed the capacity in other countries and continue to develop that capacity for countries to be able to detect these variants and do the sequencing work and all that. But again, as we say in COVID, we are still learning and there's a lot to learn. But we are putting up this capacity and helping countries be able to do their own sequencing.
And speaking of WHO, and when you're talking about the fact that mobile labs have been put in place, and of course we're aware that South Africa is also helping in terms of support. But my follow-up question in terms of the WHO is are there countries on this continent that the WHO might in fact be sort of prioritizing in terms of receiving more vaccines, especially due to issues that we spoke about now in the intro, in terms of the fact that there will obviously be funding constraints and even more a real need for vaccines, given how closely people live together in some of the sort of more impoverished places on the continent?
Thanks for that question, Flo. So the World Health Organization is supporting all African countries to receive the COVID-19 vaccines without prioritization, and this is regardless of how they procure the vaccines. And we do this by the support is to includes capacity assessments. We do regulatory mechanisms, cold chain capacity, increasing the cold chain capacity, the training of health workers, data monitoring and surveillance that we just talked about, for example, the sequencing, and then communications, including demand generation. So for the COVID-19 rollout, given the vaccine limited supply globally, our current focus is on finalizing the priority groups first in countries who will be immunized first, and then we can continue getting vaccine for the rest. As you may know by now, most African countries are eligible to receive vaccines at no cost from the COVAX facility, vaccines to cover up to 20% of their populations. The COVAX facility is collated by Gavi, the World Health Organization, and CEPI, and we are trying to ensure that at least we get free vaccine for up to 20% of the population, but also for those countries that are unable to procure more vaccine, because rich herd immunity countries need to procure more vaccine. We are reaching out and supporting countries to be able to access opportunities, funding opportunities from the World Bank, from the Africa Export-Import Bank, and other donors that are willing to support these countries. And of course, also with Gavi, that has put out about $60 million to increase the cold chain capacity in these countries.
Yeah, and just in closing, I mean, you're talking about supporting countries, of course, referring to the WHO and the support of the different countries on this continent. But I'd like to ask you in terms of, I mean, obviously you're looking at the continent quite closely. Have you seen a lot of support from, one country to the next on the African continent? We've spoken about South Africa, yes, but in terms of at large, is it a case of, look, each man for himself, or has there been a lot of, Africa for Africans and sort of assistance of each other on the continent? What have you noted in this regard?
Yeah, I really wish that would happen. Right now, we realize that it is really difficult because every country is fighting for its population. Every country is trying to keep their populations protected and populations alive. We've not reached a point where a country has excess vaccine, for example, to donate to a neighboring country. But we've seen countries, for example, when we run out of tests, we saw countries are supporting other countries. But when it comes to the vaccine, everyone right now is in a shortage. Every country is trying to reach 60% of their populations. And we know that in Africa, we've not even covered even 1% of our population. So really, for now, we've not seen Africa for Africa, but we've seen Europe come together and put hands together, the G7 for Africa. We have seen donations being announced, not yet realized, for the north to the south. Africa for Africa, not yet, until we hit the herd immunity.
All right, Dr. Phionah, pleasure speaking to you. Thank you very much for giving us all that information. Much appreciated.
My pleasure.
All right, that's Dr. Phionah Atuhebwe, the Regional New Vaccines Introduction Officer for the WHO.